am Suzanne Paulson. I'm the CEO and the founder of iEco, and we are so excited to be back with this series. Yes, it was a year ago that we started this, and tonight I am so excited to invite one of my heroes in the industry, an absolutely passionate doctor passionate about dry eye. You know that I'm passionate about dry eye. When you meet Dr. Durker, you're going to meet real passion about dry eye. We have been really lucky to have all of these successes. And as you know, we started with a big platform. We're really taking it regional. So many people have written in saying that they're so grateful that they're able to find a great dry eye doctor. So when you meet Dr. Damon Durker, who I'm going to introduce here shortly, I know that you're going to be incredibly excited if you're living in the Indiana area. And if you haven't watched the little trailer that he made, please do, because you are going to be really happy. So tonight, for a half hour, we're going to spend some time with Dr. Damon Durker. He is the Director of Optometric Services. Let me get my little slides here going. There we go. At Eye Surgeons of Indiana in Indianapolis, Indiana. Dr. Durker, welcome so much.
No, I appreciate it. Thank you, Suzanne. And I love your energy. When we first met, years ago, it's like, wow, who is this Suzanne? She is so passionate about helping patients, and we really connected right away, and it's been great. And thank you so much for the support and the opportunity here. And we had that promo that went out this week, and what was pretty cool is I had a patient in dry eye clinic on Tuesday that said, hey, I saw that email from iEco, and I actually saw what you look like. I've never seen you because you only wear a mask. And so my patients were appreciative of the video.
Oh, that's so wonderful. Well, yeah, it was. And one of the first things that we connected so immediately on was our passion for Sjogren's patients and helping Sjogren's patients. And that, of course, as you know, is why I started the company almost 19 years ago. And I know it's something that you're very passionate about as well, with all dry eye, but in particular. So I applaud all the work you've done for decades, helping dry eye patients, and not just the patients, but also for the audience out there. Dr. Durker is one of the most influential people, boots on the ground, no joke. He has a program that he started calling the Dry Eye Boot Camp, inspiring his colleagues to embrace dry eye at the same level with the same passion that he does, and making incredible inroads to having more great dry eye doctors out there. So we're honored to have you with us tonight. So I'm so excited. And you brought 3 great case studies, success stories. And I think it shows that all of just the complexity of dry eye, and also how there are so many tools in the toolbox now to be able to improve the quality of life for people out there who they know they have it, or maybe they don't even know that they have it. Wouldn't you agree with that one?
Yeah, I think that it's interesting, because the modern definition of dry eye is the patient has to have symptoms, or we don't call it dry eye, we call it something else, neurotrophic keratitis, or episodic dry eye. So dry eye patients have symptoms, but a lot of times, as you know, and our audience knows, that the symptoms are not always burning, irritation. It's visual, it's fluctuating vision, it's eye fatigue, it's burning, it's itching, it's things that we don't always, dry is not a very common description for my patients. So a lot of patients come in, especially here in central Indiana, oh, it's got to be my allergies this time of year. Well, maybe allergies set it off a little bit, but most of these patients have underlying lid margin disease, or maybe they're on medications that make them more at risk for dry eye, or maybe they have a systemic disease that would eventually lead to ocular surface issues. So it's really great to get to know these patients, dig in to try to figure out not only making the diagnosis of dry eye, but also understanding why they have it, so we can go after root cause and have a better chance of getting a successful treatment.
Yeah, and it's a true statement, that the large majority of patients with dry eye are asymptomatic, correct? Which is part of the challenge on your side from the physician standpoint, because many people, they don't have symptoms. You'll go in and say, you got it. No, I don't have it. But now with the invention of all these super diagnostic tools to be able to show people visually what's going on with their structure of their glands, it makes it that much more effective in being able to educate folks that, look, even if you don't have symptoms, this is going on in your body, and you need to pay attention to it so that you can have the highest quality of life, visual acuity, visual comfort.
And my experience is that these asymptomatic patients are really pre-symptomatic. Is their body is compensating right now until it can no longer compensate. And whether it's they go on an airplane or they start wearing a mask or they're on Zoom calls all day, or maybe they have cataract or LASIK surgery and that just sets them off, is they're asymptomatic until something pushes them over the edge, but they're in a state where it's just very delicate that they're hanging on and they're able to compensate. And just the slightest thing that pushes them out of that homeostasis is going to really set off their symptoms.
Oh, yeah, great point. Great point. We're going to also, for the audience, for those of you that are new to our series, there is a chat section. You can probably see it. Feel free to put questions in that chat section. At the very end, we're going to ask Dr. Durker as many questions as we can get to. We're going to allow at least 8 minutes of the episode to that. And whatever we can't get to, we promise that we'll follow up via email and answer those questions for you. So with that, Dr. Durker, why don't we start with your first patient here? This is a first thing I noticed was the age.
And that's the first thing that I noticed, because when I was back in optometry school 20 years ago, female over the age of 50, those were the dry eye patients. Now we know that that is not the case. There's more and more males that we're diagnosing with dry eye and MGD, and these patients are getting younger and younger. And we think that that's probably due to digital device use, dietary habits, our environment. We're just not prepared to handle all of the onslaught that is coming at us that affects our ocular surface. So this is a 28-year-old female. Started seeing her a couple years ago. She's a dental assistant, so she's staring with magnifiers and face mask and shield on all day, bright lights. So she's got a lot of stress on her ocular surface. Probably not blinking very much. Probably an incomplete blinker, and that's actually what we found in this case. And she came in because she had suspected that she had had dry eye and had been on some therapy in the past. She did experience burning and difficulty, and especially with computer use, that kind of made things worse. And what we're finding, tends to be the monitors are even a little bit worse than the smartphones in terms of what's driving symptoms. Fluctuating vision, just so common, and is one of the things that I screen all of my dry eye patients on, is how is this potentially affecting your vision? So I think that if you're going to a dry eye doctor, they should be asking you, are you having blurry vision? Are you having fluctuating vision? Does it get worse later in the day? Because that may be the only symptom that you have. And really that's a dry eye issue. That's not just, oh, my contacts aren't that great, or maybe I'm just getting old. You probably have dry eye with that symptom.
Interesting. What about the comment, because we hear about screen use or in phone use, digital devices all the time, but you think the screen, just because of number of hours that people are staring? More
number of hours, and then our blink rate goes down significantly. So we should be blinking 10 to 15 times every minute. And I'm sure I'm not doing that now in front of the screen, live audience. But most people that are using devices, that can go down to 3 or 4 times a minute. So wow. You're literally blinking about 1/4 as much as you should. So when you're not blinking, or you're not blinking completely, you're never stimulating the glands in your eyelids to release oil. And eventually those oil glands, they just start to die. And that is what is going to cause most dry eye, or at least contribute to it, is poor oil production, and poor blinking and screen use is definitely a leading cause of that.
Interesting, very interesting. So looks like you use some questionnaires when you're diagnosing, and some osmolarity.
Yes, we can talk about the patient journey at eye surgeons when they see me, and it doesn't matter if somebody's coming in with a retina issue, or maybe suspected glaucoma or a cataract or dry eye. Everybody gets a screening questionnaire, and we use a modified speed, which is going to assess for symptoms of evaporative dry eye. And it's going to look at severity and frequency, and we get a score out of 28. And if that score is 6 or higher, that's been shown to be significant. If it's 10 or greater, that's actually moderate to severe. So when we say that this patient has a speed score of 15, they're pretty symptomatic. And we do that on every single patient, because it doesn't matter if you are coming in for a diabetic eye check. We don't do glasses or contacts in my practice, so I'm not doing routine care. Most patients have a medical issue. But it's so common that if someone has hypertension, diabetes, any sort of thyroid issues, dry eye is so common in those patients. We really want to screen everybody, because they may not realize that they actually are experiencing dry eye. So we're educating them right when they get to the offices. Dry eye is extremely common in our practice. We take it seriously. please fill out this questionnaire so we can understand how this may be impacting you, because we've got solutions for you.
Perfect.
Then
And
that triggers,
sorry.
different diagnostic tests and osmolarity and other things. But I think if you're going to a doc and you're getting dry eye care, a questionnaire, a detailed exam, and then a customized treatment plan are really the three key things. And that we do that in my practice for every dry eye patient.
That's wonderful. That's why you're a great dry eye doctor. That's how we define it. We've been asked many times during this series, well, how do you vet? What do you do? And you just named it. It's like you're screening everybody. You're doing the questionnaire to get the symptoms. You're doing the diagnostics to see the signs. You got the in-office equipment to take care of them, whatever they need, and you're sending them home with whatever they have to do as an ongoing maintenance. And that's how we qualify, and that's exactly what you do. And I wish all doctors were like you. Okay, so we have a fun video coming up, and what I just go back to is 28 years old, and this patient has a speed score of 15 out of 28. That's crazy.
That's pretty significant. And Accutane use in the past, and we've diagnosed dry eye, MGD, blepharitis. Let's go ahead and look at that video, because this is something that I do on every patient. Every time they come into my office with a dry eye complaint or a known history of dry eye or MGD, is what we want to do is we want to press on the oil glands, because when we look at this patient's eyelid, it looks pretty healthy.
Yeah.
I wouldn't suspect that there's an issue until I start pressing.
Nothing's coming out.
Then nothing's coming out. And this is why this patient has a problem. She's got obstruction of her meibomian glands, which is the leading cause of dry eye. And we're going to need to address the obstruction both with in-office treatment and at-home treatment, combined with maybe some environmental modifications to be able to treat this successfully. So in this case, I would recommend that we do a BlephX, which is a lid cleansing procedure, which we do commonly in my practice. And then we use this handheld device called an Eyelux. It's a thermal pulsation device. If you're familiar with LipiFlow, it's got the same indication. And what we're doing is we're heating up the eyelid to liquefy the contents of that oil, of the oil glands rather, and then just doing gentle compressions to open up those glands. It's about a 10 to 12 minute procedure, very well tolerated by a patient. And 80% of the time when we do that, we have a significant improvement in patient symptoms. So patients understand right from the get-go is that I can do things in the office to help you, but very similar to going to a dentist and you go and do your deep cleaning, you got to do the brushing and flossing at home. And this is where Eco products and Hydro Eye supplements come in, as the patient understands that part of their success is going to be on them. Is I can make the diagnosis, I can help with in-office therapy, but really to have the best treatment, best chance for treatment success is going to be a combination of all three of these things that you see on the screen. And I think that is something that I try to educate my patients on day one, is that we're in this together. I'm going to do everything I can, but you're going to have to do some things too if you want to have maximum success.
That's great. I wish we had more time. We're already halfway through the show.
It goes quick.
It goes so fast. It goes so fast. So I'm not going to go back to the video, but for those of you who might not be familiar with it, when he was pressing on those glands, what you should see is oil coming out of those glands. That looks like olive oil consistency, correct?
Correct. Olive oil coming out of most of the glands. In that case, what was coming out looked pretty good. It just happened to be that probably 75% of her glands are obstructed. So we do the in-office treatment. We start her on a supplement, a short steroid course. We've got her on Tranquilize XL, and she's doing those things on a regular basis. She comes back in 2 months. Now she's just 4 out of 28. So significant improvement just with that single treatment at home. I'm going to be assessing speed every time. I'm going to look at those glands every time. There's a lot more of those glands that are expressing that clear olive oil secretion. And why do I love this one is because she's only 28. She's got a life expectancy of 50 or 55 more years. If you don't identify and treat that problem, it just becomes so much harder to treat her, and she's going to have more symptoms. She is going to have a quality of life issue. And I think that it's screening for this and being aggressive in how we manage it. And I'm glad that she found me, and I'm glad she didn't find me, because sometimes these patients don't find me until they're 58 or 68. And I said, boy, I wish I saw you a little bit earlier. It's much easier to treat you.
Exactly. And that's more like this patient here, who's 71. But for all of you out there that are parents and you have, kids that are in their 20s, I guess they're not kids, adults, like make sure they're taking care of their lids and they're going in there, because more than likely they're doing everything that we're talking about right now, staring at devices and staring at screens and may not even know what's going on with the health of their lid margin. So this one, Dr. number 2, 71-year-old
Yeah,
man.
so the first case is kind of a good overview of how I approach the disease and things that we're doing. Here's some really great cases now. This guy's 71, dry eye fatigue, burning. He's getting ready for cataract surgery. He doesn't want to do a whole lot at home. He's tried drops. They're not for him. He's got rosacea. I've got him taking doxycycline. He was taking that. I don't want to keep people on that very long. So it's something that this guy is going to definitely need more in-office work because he's not willing to do a whole lot at home. He's got a speed score of 9. He's got increased inflammation on the surface of the eye. And again, this guy's getting ready for cataract surgery. So if we don't treat the dry eye issues before surgery, the surgery can exacerbate things, make his symptoms worse, and also make it so that he just doesn't have as good of a visual outcome. We can't actually take measurements accurately. So if we go to the next slide, you can see this gentleman. We do meibography as part of our baseline dry eye evaluation. I don't repeat that at every visit, but I'll do that periodically. And this guy has most of his meibomian glands, these white structures here. They should look like piano keys. His are a little bit, what we call tortuous, but he's got most of his glands. So this is the guy I look at, say, I'm pretty sure that I can help you. And he definitely has some redness and definite rosacea appearance to his skin. And when we treat this gentleman, I'm going to say we need to treat your face to treat your dry eye because he's got inflammation all throughout here. So in these cases, we can't just use an eye drop. We're going to use something called intense pulse light or IPL. And here's one of my heroes, I'm sure Suzanne's heroes, Laura Perriman out in Seattle.
Yeah.
Who taught us so much about intense pulse light. Is this patient, I recommended IPL course, which we do at our main office. We'll typically do 4 sessions and we'll do a manual gland expression after each IPL therapy. And what we're doing is using light to target abnormal vessels. And that light energy is absorbed to basically close these vessels down, decreases inflammation. It helps to thin out the oils coming from those glands. It helps to kill any bugs on the lids and lashes. So multiple things that an IPL is doing. We simply switched him to a nutritional supplement that's a little bit more appropriate to take long-term, and just artificial tears is needed. So this gentleman, we're not doing a Restasis or Zydra. I use those a lot, but this gentleman is just not going to do those medications. So we focus more on in-office. And then typical lifestyle changes that I'll talk about with all my patients is taking breaks when using digital devices, staying hydrated. And a gentleman like this, we want to make sure that if someone's using alcohol, it should be in moderation because heavy alcohol intake is actually associated with dry eye.
Interesting. And with this intense pulse light, it's never touching the lids itself. It's just that the energy that you're treating around it helps support.
Yeah, right in this area here. And then for a lot of people, including this patient, we'll do a full face treatment because there's aesthetic benefit as well. So they get a nice cosmetic benefit. But the main thing is I'm reducing inflammation that is associated with dry eye and their lid margin disease.
That's terrific. And so I love this, and my wife loves it.
Look at this guy. We just did 4 treatments. You can think about what he looked like before. He's happy. His skin looks better. First thing he comes in after we get done, Dr. Durker. My wife loves how I look now. And that was so awesome to see. His speed score went down. His gland secretions improved. He's going to have a smoother course with cataract surgery. Dry eye is going to impact how patients see, feel, and look.
That's awesome.
And it is fun for me seeing a guy like this. Is like, I've made this guy happy. I made his wife happy. I mean, 2 for 1 in this case. So this was a lot of fun with this. I still see this patient. And I'm doing an IPL every 6 to 12 months for this gentleman to maintain what we've done.
That's terrific. That's a really fun one. And then on our third one here, we got somebody who's quite kind of in the middle, huh?
Well, kind of in the middle as far as age, and this is maybe our typical dry eye patient,
24 out of 28. Wow.
She's high speed score. She's can't wear contacts. She's having to use teardrops every 15 minutes. If you can imagine that. And these are things that, if you're having to do that, boy, if you're even having to use a tear more than a couple times a day, go in and see somebody that specializes in this, because the tears are not treating anything. They're giving you some temporary relief. This patient has constant irritation and burning and blurry vision. So she's just trying her best to put out that fire with the teardrop. It's not working. So she actually has her vision on the eye chart. She's barely legal to drive.
Wow.
Because of her dry eye, because the cornea is so irregular on the surface, so dry, these dry patches all over, like we'll see, is this patient has visually significant dry eye that's making it so that she can't do her job. She can't wear
Oh,
contact.
man.
She's 44. We've got a long ways for this patient to be able to need to function. So this is a patient that I tell them right from the start when we have a case like this is I'm not going to be able to get you better in a period of a couple of weeks. It's going to take several months or more because you've got a pretty significant problem. And my hope is that we can have all of my colleagues in optometry and ophthalmology not let this happen, where this patient gets so bad that she has to, consider quitting her job because of her dry eye and the visual significance of that.
Wow, we just hope that's the future where that screening becomes the normal, like screening everybody becomes the normal regardless of
I
age.
think early intervention and
Yep.
screening is just essential.
Yeah, wow, poor thing. I really empathize because we hear it all the time, and it just changes the quality of life to a point where it's debilitating.
So this
So
is a patient that I'm going to use multiple anti-inflammatory therapies, topical steroid drops for a few weeks, then we'll use those for flare-ups. We started on Zydra, which is a designer drug for dry eye. We'll use twice a day. This is a patient we actually use a biologic contact lens to put on the surface of the eye. It's derived from human placenta, from amniotic membrane, and then it's processed and frozen so somebody else can use it and put on this ring, so it's like a contact. And we place that in the eye in the office. We leave it in for 4 or 5 days, and then the body just absorbs this tissue, and it's anti-inflammatory. It promotes stem cell activity. It can actually repair damaged nerves. So this patient, probably with how bad her cornea looks, she probably has some nerve damage, and a Procera is one of the treatments that we'll do for this patient. We're also going to recommend things like dietary omega fatty acids. We're going to stop her contact lens temporarily. And then just be aware of your environment, fans that are blowing towards you. If you're on the computer, make sure that you have the screen down so you're not looking up at a screen. Making sure that when you're in the car, you don't have vents blowing directly at you. Or some of these patients are going to need moisture chamber goggles as well. So the environmental awareness is something that some patients are acutely aware of, but others need to be reminded that a ceiling fan when they're sleeping and they're not wearing eye protection overnight can be a real problem.
yeah, I noticed that in your at home because I would think that somebody like that would really benefit from a hydrating mask at night too.
Absolutely.
Yeah, there's a holy moly, look at that. Oh,
They've got all of these dry patches on the surface of the eye. We put that in, and we leave it in for 4 or 5 days. We take out that ring, we do one eye at a time. And this is the result that we get. She's going to 2020, 2025. So she's gotten 3 or 4 lines better on the eye chart after the Procera and the other therapies that we're doing. This is a study that I was involved in called the DREAM study that looked at patients that had Procera placed, and it found that 95% of these patients had significant improvement in their ocular surface that lasted at least 3 months in the study. So this is a situation where we do anti-inflammatory, both in the form of omega fatty acids as well as topical. We do the Procera therapy and we keep them on the other anti-inflammatory so that hopefully it never looks like that top image again, where they have these dry patches all over the surface.
got it. So that was a question that's coming in because we're getting into our Q&A here. We have 6 minutes left. But that was one of them, was how frequently does this have to be replaced? And that it's right there on the slide. So basically every 3 months or so they're replacing.
It lasts for at least 3 months. It's really individualized to the patient. Sometimes we'll use a couple in a series, but I do it when we're having problems in the cornea related to dry eye. So there's some patients, maybe we have to do that once or twice a year. Others, we do it once, we get the ship on the right course, and then we don't ever have to do it again. So it's very much individual.
Interesting, which goes back to your opening point of that really what all dry eye patients deserve is a practice, a physician that you're walking into and you're getting screened. You have the diagnostics, you have the in-office tools available for treatment, you have the at-home treatment options available, and that you get a customized treatment plan because it is so complex that there is no one recipe for everybody. It just
absolutely. So I mean, this could be in my clinic 3 consecutive patients, and they all have symptoms. They all have visual consequence of their dry eye, but I treated all 3 of them very differently based on what I see. And then I think even more importantly, treatment goals, is I try to make sure that I understand what's bothering the patient, what they're hoping to achieve. And this patient just wants to be able to see, she wants to be able to get back in her contact lenses.
Right.
We're going to focus on that as our main strategy. Is how can I get that person to meet their goal?
Right. And like patient number 2 with the
Compensation we have
cataract
to be
surgery.
aligned on.
Yeah, and patient 2 was cataract surgery, right? So it's like whatever their goal is. Some of the other questions that are coming in. When do you recommend a workup for Sjogren's?
So as part of our dry eye evaluation, first time patient, our technician obviously will gather medical history and we'll look at things that may be an issue with history of autoimmune disease in the family. But I ask everybody at that first visit is we inquire about dry mouth, we inquire about joint pain or chronic fatigue. And any of those things, we're going to prompt a little bit further discussion. I will go ahead and order a show panel to look for early markers of Sjogren's. And then very often I get those patients that we identified with dry eye and dry mouth in particular, but even dry eye in combination with just, I just feel miserable all the time. I'm always tired. Those patients deserve a rheumatology consult. So we arrange that and we're co-managing these patients with rheumatology. So I probably have a couple hundred Sjogren's patients in my practice now, and probably at least a quarter of them have been diagnosed after seeing me because they presented with dry eye and we investigated further, and sure enough, they end up with a Sjogren's diagnosis.
And that the show test that you mentioned, that's one with saliva? Was that
That's blood draw. So we're
blood
looking
draw.
at traditional markers as well as some novel markers that are elevated early on. So it can help you maybe get to a diagnosis sooner than your traditional Sjogren's markers or even a salivary gland biopsy.
Perfect. Yeah, that's because that was what they used to do. Is IPL better than MiboFlow or thermal flow?
So it's different. So IPL at its core is a anti-inflammatory treatment, which I think that really the way I teach dry eye to my colleagues and my students and the way that I practice is inflammation, biofilm, and obstruction in terms of what we're treating. Is if you have dry eye, you've got inflammation as part of that process. IPL is going to be primarily anti-inflammatory. MiboFlow, as well as Dierker, Eyelux, LipiFlow, even some of the things that IECO has that we can use in the office to be able to do heat and expression, that's to remove obstruction. So they're different things, they're complementary. And almost all of my patients have something that we're going to address: their inflammation, their biofilm, which is their blepharitis, the bacteria on the lids. We do lid cleansers, we do in-office debridement, inflammation, biofilm, and obstruction. And that's where that MiboFlow would fit in as one of the tools to help with blocked oil glands.
That's great, because the biofilm is much like plaque on teeth, correct? Yep. So it's something everybody develops, and it's important to make sure that you get rid of it, or else it just completely wipes out the ability to be able to have those glands stay nice and open and clean and operative to a certain part of the equation. I'm trying. Okay. I've noticed that when I use the computer a lot, my vision is blurry when I blink the next half day. Is this because I'm tired? Any suggestions to help me?
I think you need to come see someone.
See you. Come see you. Yeah.
Depending on where you're at. And I've got a lot of great colleagues all over the country, but make sure that you're going to somebody that is not just offering you, here's the latest teardrop, I'll see you next year. Yeah. Because you deserve more of that, more than that in what you just described, that patient there. And I think that we want to make sure that understanding that is not normal, and there's things that we can do to help that. So I would say that you can take breaks, you can stay hydrated, but you probably need to see a dry eye doctor to be able to get some more definitive treatment.
Okay. Do you have time for another question? One more question? Are you good for one more? Dr. Durker?
Yeah.
Okay. I guess there's two. This one might be short. Do you have any homeopathic treatments?
Homeopathic, I would say, would fall into the things that are not medicinal or in office, but a lot of the things with lid hygiene, nutrition, omega fatty acid supplements, warm compresses, I would say that fits into homeopathic.
And lifestyle, even we've discussed a lot on this series, the impact of stress, different things it goes back to I tend to put it in the buckets of it's the environment, lifestyle, physical condition. So there's things that you can do in all of those really that can be homeopathic in helping to treat it. One last question. Hold on. Let's see, I use a CPAP and I think the air blows into my eyes while I sleep. Will my eyes begin to dry out, and what can I do to prevent this?
I would go back to my answer for the last question is
Go see it.
and this is where Suzanne, you can speak to it. I mean, you've got some great products to help these patients. We know if you're on a CPAP, almost 100% of patients that have sleep apnea on a CPAP, they're not closing their eyes completely when they sleep. They have incomplete lid seal. So this is where we use the iSeals 4.0 sleep mask for patients to protect them from having that desiccation of the surface of the eye overnight. So if you're wearing a CPAP, there's a lot of different solutions that iEco has to be able to protect the surface of your eye overnight. So that you can go to their website, but I also think that go in, get a good diagnosis. We actually do a test to look for that.
Wholeheartedly agree. Yeah,
I think that is critical.
Yeah, and that's what this whole series, I know we're out of time. It goes so fast. And I can't thank you enough, Dr. Durker, for your years and decades of work in this area. And you truly are setting the bar for your colleagues of what really I believe should be standard of care. I mean, could be standard of care. Like, this is the future. And it's so heartwarming to see your passion for all of this. And everybody that's out there in the area where Dr. Durker is, please reach out to him. And we have a list here too. If you're looking for great dry eye doctors, you're not in his area, reach out to us. We'll give you a list of people that we've found, or he, as he mentioned, has colleagues. You can reach out to him as well. But it's with just great pleasure that we had you here today, and we learned so much. And it's just a thank you. There's your phone number there. So the 317-841-2020, and they can always take a message, or you can email us and we can relay it to him as well. We do just want to close it really quick. We do have another one coming up in November. We're really excited to have Dr. Angela Bevels join us. She's an optometrist also out in Tucson, Arizona. She's a veteran. Yay! And she has her practice is called the Elite Dry Eye Spa. She does a lot of the aesthetics that you mentioned, Dr. Durker, too, but she's as passionate as Dr. Durker and really making sure that people have a customized treatment plan. So if you're in the Tucson, Arizona area, stay tuned. November 10th, it's day before Veterans Day. And with that, we are just so grateful to be back. I'm so happy you all joined us today. And Dr. Durker, thank you again. I hope you have a wonderful rest of your evening and a great holiday season.
Thank you, Suzanne, for the opportunity.